Hello everyone, and welcome to the first session of our new Medicare informational series, Medicare Basics. Medicare was established by the federal government in 1965 by the Social Security Act of 1965. Medicare provides health insurance for people 65 or older, as well as people with a disability receiving Social Security disability insurance after 2 years of receiving the benefit. People diagnosed with end-stage renal disease at any age, and people with amyotrophic lateral sclerosis, also called Lou Gehrig's disease. Medicare covers most healthcare services and items, but not all healthcare services are covered under Medicare. Eligibility for Medicare is not determined or based on income. Original Medicare is administered by the federal government. Original Medicare includes Part A, hospital insurance, and Part B, medical insurance. Original Medicare pays for 80% of costs for covered services, and the individual is responsible for 20% of the cost. Part A covers inpatient hospital stays, inpatient care in a skilled nursing facility, not custodial or long-term care, hospice care, and some home health care. If interested in learning more about common services Part A covers and general descriptions, please refer to your Medicare and You handbook or Medicare.gov. Part B covers doctor and healthcare provider visits, outpatient hospital care, and some home health care, not custodial or long-term care. Part B also covers durable medical equipment such as wheelchairs, walkers, hospital beds, etc. Preventative services are also covered under Medicare Part B. It is important to understand what your cost or responsibility is for Medicare Parts A and B. Medicare Part A is usually premium-free for people who have worked 40 quarters, 10 years or more, and paid into Medicare taxes throughout this time. For people who do not qualify for premium-free Part A, premiums vary. A person who has worked between 30 to 39 quarters has a standard Part A premium of $278 a month. A person who has worked less than 30 quarters has a standard premium of $505 a month. Medicare Part A has a deductible of $1,632 per benefit period. A benefit period begins the day a person is admitted as an inpatient in a hospital or skilled nursing facility. The benefit period ends when they haven't gotten any inpatient hospital care or skilled care in a skilled nursing facility for 60 days in a row. The benefit period is not dependent of the calendar year. There is no limit to the number of benefit periods. People usually are responsible for paying a monthly premium for Medicare Part B. The Medicare Part B premium is usually directly taken out of Social Security benefit. The base monthly premium for Part B is $174.70. Some people may have to pay more for their Part B premium depending upon income. Medicare Part B deductible is $240 per year. After enrolling in Medicare Parts A and B, it is important to understand that there are additional coverage options available, such as standalone prescription drug coverage, Medicare Advantage plans, or supplemental coverage called Medigap. Prescription drug coverage, also called Medicare Part D, is an optional federal government prescription drug program that covers prescription drug needs. People are able to choose their prescription drug coverage from a Medicare-approved private insurance carrier. Monthly premiums are paid to the private insurance company. Plan costs vary depending on the plan chosen. Average base premium for prescription drug coverage is $34.70. The standard deductible for prescription coverage is $545. It is important to note that although prescription drug coverage is optional, if people choose not to obtain prescription drug coverage when they are eligible to enroll, they could experience a gap in coverage and possible late enrollment penalties. Medicare Advantage plans, also called Medicare Part C, are benefits provided through Medicare-approved private insurance carriers. Medicare Advantage plan premiums are paid monthly to the private insurance carrier. Medicare Advantage plans bundle and cover inpatient hospital, Part A, and outpatient services, Part B. Most plans also include prescription drug coverage as well. People must have both Medicare Parts A and B to be eligible. Medicare Advantage plans offer additional benefits such as dental, vision, hearing, etc. These additional benefits are limited. The cost of the plans depends on the plan chosen. Medicare Advantage plans require monthly premiums, deductibles, copayments, or coinsurance. Medigap plans are benefits provided through Medicare-approved private insurance carriers. Medigap plans cover remaining health care costs for covered services not paid for by original Medicare, such as deductibles, copayments, and coinsurance. People must have both Medicare Parts A and B to be eligible to enroll in Medigap plans. Medigap plans do not cover prescription drugs or any additional benefits. Costs of the plans depend on the plan chosen. When people become eligible for Medicare, it is important to understand your options. There are two main ways to get Medicare: Original Medicare or Medicare Advantage. There are certain times of the year where people are able to change their Medicare coverage if they choose. So, to recap, Original Medicare includes Part A, hospital insurance, and Part B, medical insurance. People are able to add drug coverage by joining a standalone Medicare prescription drug plan, Part D. When enrolling in Original Medicare, people can use any doctor or hospital that accepts Medicare anywhere in the United States. People also have the choice to add supplemental coverage to their Original Medicare, such as Medigap, former employer insurance, union insurance, Medicaid, etc. Medicare Advantage plans are an all-in-one alternative to Original Medicare. Medicare Advantage plans include Part A, Part B, and usually Part D. Medicare Advantage plans may have lower out-of-pocket costs. People enrolled in a Medicare Advantage plan will need to use doctors who are in their plan's network. Most plans offer extra benefits such as vision, dental, and hearing. That completes our session today. We hope that this helps you to better understand Medicare and a bit about the benefits offered. Please be in touch with us at the office if you have any questions or are in need of assistance. We are happy to help. Stay tuned for more Medicare information sessions to come. Have a good day.